If you have endometriosis, I want you to know two things. One, if you've had an ablation, that's not the gold standard for treatment of endo. Excision is. And not only that, not anyone should be doing excision. I see too many patients in my clinic every day that come in and have had ablation, which is not the appropriate treatment, or excision, and the surgeon came out and said, well, we didn't want to damage anything, we couldn't get it all, which is code for I'm not qualified to be doing excision surgery for endo. So you want a surgeon who only does endo excision, period. The second thing, pelvic physical therapy, specifically pelvic integrative pelvic treatment, which could be carried out by an OT. Pelvic PT is going to be more specialized than OT due to the orthopedic nature of what drives endo pain often, meaning endo is a systemic disease. It is not a reproductive organ disease. So oftentimes I get patients who come in and their endo has been mistaken for a hip labral tear. As a pelvic PT and as a functional integrative lifestyle medicine trained pelvic PT, I'm both ortho and pelvic, so I can look at all of those things. And you want someone who is going to be comprehensive in their approach, because while excision is the gold standard, pelvic PT is required. It is just as important as the surgery itself, because there are so many ways that we can mitigate the four big pain points that we need to look at with endo. If you haven't seen that video yet, where you see my whiteboard in the background, I go through 4 things that should be covered in your integrative pelvic PT. Now, this is beyond pelvic and ortho expertise. That's someone who's really well-versed in handling, treating endo from a systems-based or systemic-driven way. Okay, that's assuming your pelvic PT is really good with ortho and pelvic PT. And in addition to that, they need to be looking at inflammation, estrogen mediation, because estrogen is a driver for endometriosis and how it grows and spreads, the gut microbiome, and immune function. And so pelvic PT, integrative pelvic PT, should be looking at all of those variables, plus orthopedic, plus pelvic PT. All right, so those two, I hope those 2 things are helpful, right? Excision surgery is the gold standard, and someone really needs to only specialize in endometriosis excision. Do not go to someone who says they can do an excision, but they do all kinds of other surgeries too. That's a hard stop. For me as a pelvic PT, also as an endometriosis patient, and for all of my patients. And then 2, make sure you have a qualified integrative pelvic and orthopedic PT who can really drive it hard, as I like to say, drive it hard and leave no stone unturned and uncover every single variable that you need to manage your disease and be pain-free.